folks a couple more minutes to join, just as we continue to see a bunch of attendees coming in. So we'll get started about 2 past. Thanks. Okay, so let's get started. Hi, everybody. Thank you for joining today. We're really excited to be here for this Population Health Alliance webinar, a competitive digital health marketplace creating efficiencies and best-in-class outcomes. This is Brendan O'Connor with Solero. I'll be your DJ today. Joined by friends and colleagues from Blue Shield of California and Better Health. We're really excited for this opportunity to share our story with you today. We've been working as partners for the past couple of years and have some great learnings and experiences that we think will be helpful for everybody in the audience, and some best practices and hopefully some actionable items to walk away with today. Before we get started, a bit of table setting. We will be recording and are recording this webinar at the moment, and we'll be sending this as a follow-up to all registrants. Please feel free to share with any colleagues, friends, or anybody else who you think would be interested in learning about the content of the presentation. Everybody will be on mute for the balance of the presentation, but please feel free to use the Q&A function throughout the presentation to drop ideas, comments, questions. We will try to reserve about 15 to 20 minutes at the end of the presentation to open it up for some live Q&A and discussion. So if you are able to kind of hold your questions, please jot them down or drop them in the Q&A front. We'll do our best to leave plenty of time at the end to get to everybody's questions. With that, let me turn it over to Thomas for a introduction from the Population Health Alliance.
Thanks, Brendan. And on behalf of the Population Health Alliance, I want to welcome everyone to today's webinar. I'm Thomas Johnson. I'm the Executive Director of the Population Health Alliance. Our members are on the cutting edge of best practices and outcomes in today's healthcare delivery system. And today's webinar is an example of those best practices put into action in population health management. Before we get started, I want to also mention that PHA will be holding its annual summit in October on the 26th and 27th in Washington, D.C., where you can hear more presentations like this as to how population health is advancing. You can go to our webpage for information at www.populationhealthalliance.org. And with that, I'll turn things back over to Brendan.
Thanks, Thomas. Really appreciate your leadership and you inviting us to talk to your members and share the stage with you today. So we do have a presentation. We'll be walking through some slides, but we'll keep this pretty conversational. And I just realized that I probably picked the worst possible picture, Dr. Farrow. I have slices of cured meat for a webinar about lifestyle medicine and health.
It's all about balance, Brandon. Look, that looks beautiful to me. Your body knows what to do with it. So a little bit of that can go a long way. And you got all the fiber to go with it. So I think you're good to go.
There we go. A little prosciutto now and then doesn't hurt everybody.
Right.
So I'm going to ask Angie and then Bill to just do a quick intro of themselves and kind of why they're so excited about this partnership. But before jumping in there, just a brief overview. Solero, Blue Shield of California, and Better have been working together for a couple of years now as partners on Blue Shield of California's Wellevolution, which we'll be talking a little bit more about today. We all work very closely together on a weekly basis, daily basis sometimes, to drive forward improved health, engagement, and outcomes for Blue Shield of California's members through Wellevolution. Solero kind of serves as the chassis or backbone from a technology standpoint and services standpoint to make all of that work. And we'll unpack some of that today. And Better Health is really one of the highest performing, most popular partners and point solutions that's available to Blue Shield of California's members on the platform. So really excited to have this little group here together to share our story. We're going to have a couple of guest appearances at the end as well. So thanks to everybody for attending. And with that, Angie, can you do a quick just introduction of who you are, what you do for Blue Shield of California, and kind of what wakes you up and motivates you every day?
Absolutely. Thanks so much. And let me just say, I'm so excited to be here with my friends and colleagues. And as Brendan said, we're a tightly knit family, and we have a lot of good work to do. So my name is Angie Kulisek Ebrahimi. I am the Senior Director of Lifestyle Medicine at Blue Shield of California. I've been at Blue Shield for about 11 years. And I guess backing up to kind of what motivated me to even get into this field, I guess I'll just start by saying, my dad was a doctor, my mom was a nurse, my sister's a physical therapist. And when I graduated from college, I said, I'm going to do something totally different. I'm going to get a business major and I'm going to be the black sheep of the family and break out. But I think there was just something in my blood that over time really drew me back to health. And I think I took a slightly different take on it. And the aspect of health that really interested me and still wakes me up every morning is lifestyle. And this notion that lifestyle has the power not only to prevent, but also treat and reverse disease, which is exactly what we're doing at Blue Shield of California. I did a little stint in what we would call wellness, traditional wellness for Visa. And then I started working at Blue Shield, and we've done some really great innovative work at Blue Shield that I think has led us to be one of the best in class solutions for lifestyle medicine of any health plan. And I say that very proudly, and also very humbly, because I think there's a lot of onus of responsibility to continue to deliver. So that's why we partner with people like Better and Solero. And just, again, really happy to be here. So thank you.
Thank you, Angie. And Bill.
Oh boy. Okay. So I'm the most unlikely of the bunch. I started out as a chiropractor. And if you would have told me, 20 years ago that one day you'll be tackling and reversing chronic disease, I would have said, you're the quack, not me. And what happened for me was pretty simple. I put an office inside a health club. We had physical therapy, chiropractic, acupuncture, massage, nutritionists. And we were trying to throw the whole kitchen sink at them, if you will, and turn that one location into about 30 locations. And just watch people fail with the traditional approach of move more, eat less. We've oversimplified it. We blame the individual. And I just started looking a little bit deeper and realized that our environment has gotten very toxic and stressful, and that creates inflammation, and inflammation creates insulin resistance. And unfortunately, it's also affecting our gut microbiome. So simply put, I just looked for a different way, found that every human is different. we started doing an elimination reintroduction food protocol, heavy emphasis on digestive health, and Better Health was born. And so what made me passionate is people kept coming to me and say, "Hey, doc, it's my back, it's my back, it's my back." And I'm like, actually, I think it might be your front. I think if we actually figured out the front, what's happening in your digestive system, maybe this inflammation would go away. Maybe this pain would go away. Maybe we know the brain gut connection, you'd have less anxiety. So it got me just even more and more excited to watch just very quickly how powerful the human body is and to repair itself in 30 to 60 days. You can be coming off insulin medication. Of course, there's all the preventative aspects to it. And it just got me really excited. What makes me super excited, because if you would have told me 20 years ago, I'd be working with a health plan and a group like Solero to be in a market where we're shedding off the fee for service and we're going pay for performance, I also would have said that you were crazy. And so what makes me so excited is we're moving at lightning speed to get the members the help they want, creating a movement. And truthfully, it has to be this fast because we're out of time. The epidemic is just beyond us, mental, physical, autoimmune diseases. So the speed in which both your organizations are operating allows me to just go and do what I do. So I appreciate the partnership, and thank you for Population Health Alliance for putting this on.
Thank you, Bill. Really appreciate both of your passion and excited to dive in. So, Angie, the origins of this partnership really kind of roll up to lifestyle medicine. For those in the audience who may not be familiar with that terminology, can you just spend a few moments kind of explaining to us as an expert in lifestyle medicine, what is it and why does it matter?
Yeah, absolutely. At the heart of it, Brendan, is really what I just said, which is that we know that lifestyle is a form of medicine because it has the power to not only prevent, as we all sort of know and can rally behind, but also to treat and reverse disease, which is a lot of the great work that Dr. Farrow is doing with Better Health. And I think that one of the interesting things about lifestyle medicine is that it's often the most clinically effective solution, but it's pretty much always the lowest cost, right? The most cost efficacious solution. It's not invasive, and there are, well, let's say there are no negative side effects. In fact, all of the side effects that you get from lifestyle interventions are positive. You know, you work to treat diabetes, but you also lose weight, you sleep better, you have more energy. All of these, your skin is better, your hair is better. I mean, all of these things like compound that lifestyle can transform not one part of you, but sort of the whole person. And it is, you know, it's an approach that is science-based. It's not something we're making up. We know that food, exercise, sleep, social support, stress reduction, tobacco cessation or you know, absence of tobacco, all of these things can contribute to a whole person, you know, in optimal health.
So when I hear that, it sounds like one of the foundational kind of ideas behind this is that we need to start breaking down silos between treating conditions, which is still by and large the prevalent way in which health systems and health plans and providers are supporting members or patients with the various issues that they may be facing, in moving more towards a whole person health model of care, which is more complex in some ways, but from what I'm hearing you say, there's all of these kind of ancillary benefits of lifestyle medicine that bleed into the different approaches that traditional providers and clinicians are taking when they're treating kind of these conditions on an individual basis. Can you talk a little bit more about kind of how you at Blue Shield of California are kind of viewing that as part of your broader strategy?
Yeah, well, I mean, we have a whole initiative right now that is called Healthcare Reimagined. And so we are really, truly rebuilding the way we not only practice healthcare, but it's a different way of thinking, right? It's a way of thinking that when you're getting care for your physical health, that there's care coordination for your mental health, right? When you're getting a pharmacy, that we understand if they're going to a prescription, pharmacy prescription, we understand if they're going to be side effects. Is that drug really going to be beneficial for you? So we are kind of, pharmacy care reimagined, behavioral health reimagined, and health reimagined. But the goal of it is to treat the whole person. And I think that there's one other element that we're introducing into this continuum, which is health at home. And I think what we're doing with Wellevolution, and I can talk a little bit more about what Wellevolution is as well, is we are allowing people to access self-care, right? They can go onto the platform, they can understand the different options that are available to them, and they can pick a provider to work with that will treat them right in the comfort of their own home through digital coaching, telephonic coaching, and that type of thing. So there's a lot that we can do for our members without them having to go see a doctor or multiple doctors or get a prescription or multiple prescriptions. And that's what we're doing with Wellevolution. So maybe, Brendan, do you want me to sort of break down what's in Wellevolution at this point?
I would love that.
Yeah.
I know too much about Wellevolution, and I imagine our audience, there's some people out there who would love to learn a little bit more. So let me go to the next slide and would love for you to focus on kind of core components.
Okay, absolutely. So within Wellevolution, one of the sort of tenets of Wellevolution when we built it was choice for our members, but curated choice. So in other words, we give members the option to pick the provider or the solution that works best for them, but we help them understand what might work really well for them based on their health needs and their health preferences and so on. So within Wellevolution, we have something basically for everyone across the health spectrum. So we have 29 general well-being programs. These are for people who are not sick, right? These are people who are generally healthy. Maybe they want a little support with exercise or improving their intake of fruit and vegetables, or starting a meditation program. So we have those programs. We have 6 tobacco cessation programs, each slightly different approach. So again, we can customize and tailor to the individual's needs. And then we have programs for diabetes prevention. And I will say, like, it's the diabetes prevention program, but truly this is a risk reversal program. So it doesn't matter whether you're pre-diabetic or you're pre-hypertensive, all of the programs in the diabetes prevention program will address people who are at risk for developing cardiometabolic chronic conditions. And then we have condition reversal programs, which would be type 2 diabetes reversal, obesity management, and hypertension reversal, and so on. We've also just recently, we're very focused on this idea of health equity. And I know we're going to be talking a little bit more about this as we go through the presentation. We've introduced some social programs, one of which is a food insecurity program with which we're partnered with Bill and Better Health to deliver food to people who have issues with food insecurity. So that is sort of the totality of what Wellevolution offers. Again, sort of a one-stop shop, end-to-end health spectrum choice, but curated choice for the member.
Angie, what's so different about this approach when I look at it from a health plan lens? I think one of the frustrating points over the past decade or so, as wellness has emerged as a theme and this recognition of the need to focus on social needs of members and prevention, is that a lot of health plans out there have been reluctant to invest in the long game. When I look at this list of solutions available and the totality of what you're offering members, I'm seeing a solution that works for 100% of your population. This isn't a condition management or a care management program with a spin on it. When I look at this, I really see a program that is focused just as much on the individuals who may not be high cost, high need member today. Just as much of a focus on helping them with wherever they are in their journey to better health. Would love to just kind of hear how an organization like Blue Shield of California, like so many others, traditional insurers, were able to kind of steer the ship to kind of rethink where you're placing your bets and where you're investing, not just in the sickest of the sick to reduce costs, but also your healthy members.
Yeah, absolutely. And actually, I believe in the next slide, there's a little map of kind of how we got to where we are exactly. Yeah, so Solero, you guys had a really big part in this, right? We, in late 2016, early 2017, there was a mandate that all health plans had to offer a diabetes prevention program, right? This was something that was done across the country. And we did a lot of research into the different diabetes prevention programs out there. And we sort of thought, there's sort of this one size fits all. And really the approach was more kind of like care management versus really treatment through lifestyle. And so we partnered up with Solero Health, and Solero Health, as Brendan said, is sort of the technology backbone for creating a network of different types of solutions for different types of people. And so we started with Solero and launched the diabetes prevention program back in 2017 and continuing into 2018. And as we began to see the results of the diabetes prevention program, first of all, clinical results, but also member satisfaction results, we thought, we're sort of on to something here. Our members really, really like it. And let's do a little more research to see if we can't expand this further. We did a consumer code design session. We asked Blue Shield members, non-Blue Shield members, young, old, many different ethnicities, sort of what it is that they would want to see in a program that could help them address what they need through lifestyle. And that's how we created Wellevolution. It really was this idea of create an end-to-end spectrum, one-stop shop for everybody to come in and begin to address their whole person health. And so again, you know, that Wellevolution that we launched in 2019 included everything that you saw in the previous slide. We did add tobacco cessation in 2020. And then we added social programs this year in 2021. And, you know, you can kind of see the line going up here. As we move into 2022 and beyond, we have plans to introduce a lot more in the area of mental and behavioral health. So both on the low end of the spectrum and again, on the higher end of the spectrum, right? So things like, you know, stress reversal, meditation, that type of thing, all the way up to talk therapy and clinical care. So that's probably going to go live by the end of this year. We're looking at additional support around gut health. We're looking at musculoskeletal programs, women's health programs. So now that we have this framework, it's sort of like the sky's the limit in terms of how much we can build onto it, as long as it makes sense within kind of our core value, which is, you know, keeping it around lifestyle medicine.
You're not busy at all looking at this list. This
No.
is good, right? I mean, you look at this, this rapid timeline of determining that there was a kind of a single program, albeit one that's really powerful and can benefit roughly a third of the population, that you decided to anchor around to kind of build this larger vision for what Wellevolution can be. But taking a step back, kind of what were the primary drivers for Blue Shield of California in determining kind of this need for a different approach to member wellness? What was kind of really the impetus for moving from DPP to determining, okay, this can become something much bigger and a much different approach than Shield of California and other health plans have taken when it's come to member wellness?
Yeah, I mean, there are a number of things that answer that question. I think I'll try to boil it down to a couple. So one of them is, well, I'll start with the less kind of sexy one, and that is just cost, right? Cost of healthcare. So if we can actually address the cause of the condition versus just the symptoms of the condition, which is exactly what we are doing through lifestyle, we have an opportunity to save a lot of money in our cost of healthcare. So it's a very practical a need, right? And then I guess, our team, our mind body medicine team at Blue Shield of California, our mission statement is to improve the lives of those we serve. And I think that is like almost really the heart of why we did this is, for example, think about a diabetic member who's like, I'm taking, X amount of medications, and in their minds, I will be doing this for the rest of my life because there is no other option for me. But the truth is there is another option, and that option actually can reverse the type 2 diabetes. And, so not only are you off the medications, but you're off all the side effects, you're living a better life. It's exponentially better quality of life for our members. And that, you can kind of see in this slide, like as we built the platform, these were some of the things that we really wanted to keep in mind were that, first of all, we're treating unique individuals. So everyone's going to be a little bit different. Personalize the program, give them a reason why, give them some recommendations and curation, and ensure that the providers like BetterHealth will put their money where their mouth is and actually deliver clinical outcomes, which we are seeing in spades. And we can talk about that a little bit more. One of the things that we look at to sort of track, are we on the right track here, is our Net Promoter Score. The Wellevolution Net Promoter Score is about 60. I think Bill's going to beat me on that one. I think Better's is like 90. But a normal health plan is around 13, right? So you can see how we're exceeding the benchmarks of the industry, and also like just, little pat on the back. 60 is about the NPS of Amazon, which, we all, know and love. So I think, again, Brendan, there's a lot of reasons why we did this, but I think that the root answer to that question is our members, right? We're providing healthcare that's worthy of our family and friends, sustainably affordable, and we can't do that without this program.
That's amazing, and it just speaks to the power of the brand too. When I look at this from the NPS and members are liking this and engaging in the program, it really speaks to the thoughtful nature of Wellevolution from day one of being a consumer brand that helps them kind of reimagine what health insurance can be for them, and their health insurer as a core part of their team to help them on their journey to better health outcomes. So, one of the lessons learned for me kind of over the past couple of years as I've learned more and more about this partnership is brand is so critical. The healthy member today who may never engage with their health plan may not be the healthy member tomorrow. And so offering this type of solution that's comprehensive and has something for everybody can really help kind of retrain how people think about working with and navigating their health insurance. So really cool. And I promise I will give you a break, Angie. But just one more question before I turn it over to Bill for a few thoughts. What?
Absolutely.
Massively ambitious, right? Like you see health plans try to take on this type of thing all the time, and a lot of them don't work out for a lot of good reasons and a lot of other reasons. Couple lessons learned, good, bad, for folks who are grappling with how to create systems change within big, bureaucratic, siloed organizations like most health insurance companies are.
Yeah, definitely. So health plans out there listening, the big takeaway is just get out of your own way, right? We are health plans. We are big and slow, and there's a lot of, for us, we have lots of legal and regulatory and association requirements that we have to go through. So we would not have been able to do this without the right partners. So lesson number 2 is get the right partners. Solero Health was our initial partner in this, and they were able to rapidly scale this, which we would not have been able to do. And then finding providers like BetterHealth to come in and deliver on the clinical outcomes, deliver on the promises that we're making to our members. I think that's just, if I were to sum up, one big lesson, it's, if you can't do it yourself, make sure you find the right partners. And if you can't do it yourself, be honest about that and don't try. You'll have better results if you partner with others to make it happen.
Like so many things in life, my wife tells me that every day.
So many things in life.
6 things around the house. I need to.
Isn't that the truth?
Thank you, Angie. So, Bill, Better, amazing shining example of a company that has embraced lifestyle medicine to change lives and improve health. Can you just spend a few moments just unpacking a little bit more about what Better does?
Absolutely. If I can frame something for the audience too. So the way this partnership has worked is, Better Health is on the ground level. We're working with the members. We've been both direct to consumer for many years and now being subsidized by Blue Shield in this opportunity to go pay for performance and just really shine and be innovative. With Solero, what Solero did for us was able to help us through that contracting and get us onto this platform. And the fact that we could compete, right? We're all competitive. I want to help people, but we're also competitive. It's nice to be able to compete on a platform, say, hey, we're going to keep doing better and we're going to get recognized for those outcomes. Where in the previous healthcare environment, it's just fee for service and who can, basically market the best and manipulate the CPT codes the best. This is actually outcomes and saving people's lives. So without this partnership with Solero, curating and contracting and having us move at light speed, and without Blue Shield, I cannot, like, of all the health plans we've worked with, they're just so fast, they're so innovative. None of this could have happened. And I just want to acknowledge I'm incredibly appreciative at the speed in which we work. We talk about certain launches that we get off the ground. Some of them happen in 90 days, and it allows me to just focus all my attention on the members. And the way we look at the member experience is kind of like how you looked at the NPS scores. This is a realignment. This is a realignment of stakeholders. I'd never really think in healthcare we viewed the members as stakeholders initially, but now they view themselves because they're seeing more and more out of their paycheck every month to handle this increase in costs. It's gotten to a point where none of us can go against this anymore. And in the past, you would hear things like, I'm fighting with my insurance company, I'm fighting with the doctors. And then on the other side, the health insurance carriers are saying, we're fighting with the members, and the reason why is it wasn't working. So no wonder it's frustrating. The system was absolutely broke. The paradigm was broke. So the paradigm that Better Health and Solero and Blue Shield has brought into the table is we can work together. And when we work together, we realize that it can be easy and it can be quick and it can be swift. And we can see the outcomes we're all looking for. For the health plan, they're looking to reduce the cost so they can give more to their members, right? Pass it along. And for the members, they're saying, I just want to be healthy. I want my kids to be healthy. I want to have a great future where I don't just become a professional patient once I retire one day. So the way Better Health has been able to approach this at such a low cost, high scale is we're creating coaches. We're not a point solution to manage diabetes, reverse diabetes. All those things happen. But really what we're doing is we're empowering each individual to be part of their own community, first act micro locally. Because if we do not break this intergenerational chronic disease situation that we have, nothing is going to change. People are so stressed out, so inflamed, and time again, we keep trying the punishment route. We're flipping tires in parking lots and starving people and throwing more medications at them, poisoning the environment, and we're asking them to, act healthy. It's happening in our own families. I want everyone to know that this is not anyone's fault. It's just in the last 20 to 30 years, stress and inflammation and toxicity is an all-time high. So what Better Health has said is, look, just act micro locally first. Let's just fix your soil. Let's get you healthy. And then let's educate you over 30 to 60 days to become your own best health coach. And then you can be a health coach for your own family. So we start them off when they're in the most stressed out state, right? Because we all know when we're stressed out, we're in fight or flight. So it's hard to absorb new information. So it's really important that we give them that coach initially for at least that first 30 days to help them as a project manager say, okay, well, how am I going to do this? How am I going to act micro locally and get myself less stressed? So what we say is we're going to use food as medicine. And over 30 to 60 days, we're going to help you figure out what food works best for you. We're going to put a high emphasis on digestive health. And the coach is going to help you plan it out and then help you stick with it every single day. You're interacting through the app. You're taking pictures of your lunch and your dinner. You have the wireless scale that's sent to them through the partnership, so they can track everything. They get a Fitbit for certain engagement levels that they do. But ultimately, we give them the resource, the community to get on board. And within 3 to 5 to 6 days of just fueling your gut microbiome, people start to sleep better, their mood increases. Of course, they see the scale go down, which is always motivating, exciting. And then within 3 to 4 weeks, they're back, they're talking with their doctor online saying, this blood pressure medication, my blood pressure is too low now, or my A1C or my insulin levels, my A1C drops, so my insulin levels need to come down. This is happening with IBS issues, acid reflux, skin issues. So we help get them to the root cause so they can break this. And it really just comes down to reducing stress, inflammation, and doubt. And now the person is saying, wow, I can do this. And now as a opportunity, and we've even seen this with Blue Shield employees who've done the program, it just becomes a little bit of like, well, everyone should do this. How can we just have a program that says, well, diabetes people over here, hypertensive people over here, don't talk to each other. Your body talks to itself. That's ridiculous the way we've done it. Now you guys have empowered this movement and it can't stop. And if we don't do it, think about before the pandemic, 2018, we had 40% of US citizens being obese. They haven't done the numbers after the pandemic, but even the airlines are saying the average passenger is now up 9-10 pounds. To me, that's not, we're not a victim of people of lack of motivation or willpower. We have to shed that paradigm. They're stressed and they're inflamed. And this pandemic has really shown that we were ripe for this issue. So for us, it's breaking that cycle of dis-ease and helping the person unleash a healthy and happy, lifestyle for them and their family. And how great that Blue Shield and Solero can help us determine those outcomes, say, okay, what's next? What else can we do? Now we're adding in the online meditation, the yoga, fitness that they can do now that the person is more empowered. So again, I can't be more appreciative and more excited that I can only imagine what we've done in such a short period of time, what this is going to look like even just 12 months from now.
It's amazing. And one of the areas that I know everybody's excited about is the recent launch of the Food as Medicine pilot for Blue Shield's members. And for folks who on either side, whether on kind of the point solution vendor side or the health plan health system side, everybody's dealt with frustrating pilots before. They take forever. Contracting, implementation, security, compliance. You stand it up, you test it, flash forward, a couple of years until you start seeing any outcomes at all. This partnership enabled us to take the concept of a food as medicine pilot from Wellevolution to delivery in 90 days. So for people who may not be as involved in kind of healthcare procurement, that's crazy fast. Angie, and Bill, I'll turn it to you right afterwards, but would love for you all just to discuss, how did the structure of this partnership model enable that type of speed and innovation on that timeline?
Yeah, I mean, exactly what you just said. It is the structure of the partnership that allowed us to move fast on this. We already had our contracts with Solero, our contracts with Better Health. And so when we had the idea to support our food insecure members with food delivery, we said, okay, what is available to us right now within our network? And we know that Better Health does food delivery. So if we, Blue Shield of California, can subsidize the food delivery for the food insecure members in the Better program, what do we have to do to make that happen? So now, instead of it being a whole new initiative, it was simply taking something we were already doing and tweaking it to be able to offer it. And now we, as you said, we launched it in 90 days, and now we are looking to figure out ways to scale it. Right? How can we make sure that we can continue this over the course of time? So really, it's the structure and the partnership that allowed us to move quickly.
Yeah, and on our end, just because you guys gave us a call and said, "Hey, can we do this?" We're like, "We're ready to go." It was all really just about getting data and outcomes, right? So we want to just make sure we're collecting the data in the beginning to make sure that we could showcase the outcomes. But I can tell you right now, the response to this has been absolutely overwhelming. The only reason why BetterHelp decided to bring food delivery to the equation is I've always been wanting to teach people how to fish. We talk about this. This is not a dependency program. We don't want to watch your weight the rest of your life. We want to empower you with this information. However, we all live busy lives. So people would say to me, "Doc, it would be really easy if I could just go to a local restaurant that cooked better health meals." And then people said, "It would be great if you could just send them to my house." And I said, "Well, how am I going to do that economically?" So because we're a family approach, everything we do is about the family. Since we're not counting calories, you're not making these specific diet meals. We started sending them in trays. So we figured out what was the big cost of sending somebody food to their house. And it was, number one, client acquisition. If you're a direct consumer, you're spending just a couple $100 alone just to acquire a new customer. Number two, the packaging and shipping. So when I looked at the packaging, I said, this is only one meal in the same package that could hold 4 servings. So we packed those trays with servings, packed them with ice, and then found the sweet spot on shipping, which is either send them in 12 trays or 16. So you can take them out, eat them fresh, or you can freeze them. So what ended up happening was Blue Shield came to the table and said, we will subsidize some of that money. And guess what? We already had it at $5 per serving, just around $5 per serving, which is unheard of. And it tastes good. It's high quality food, and you can feed your whole family with it. And if you're a single person, you can freeze it, as I mentioned. Well, when we looked at the stats, and it's always about engagement and enrollment when you throw out these programs, right? That's the big thing everyone's worried. How do we get people to, number one, enroll, and then how do we get them to engage? So we have very high enrollment rates as it is. I think we have over 80% enrollment rate. Once someone says, yes, I'd like to do better health, we have an 80% enrollment rate. However, when we looked at adding in the new quiz, the quiz that popped people up for being food insecure, normally those people, I think it was 58% of the time, would say yes. And the obvious answer is they're worried that they don't think eating healthy, they could actually afford eating healthy. Once we added this pilot in and said, hey, what about if we gave you a gift card towards food? 100% of them enrolled, and 100% of them are still enrolled. And this is just over the last few months, and the outcomes of this are amazing. So no better way to point to food as medicine as a success than what we just have accomplished in the last 90 days. Groundbreaking, earth-shattering. However, when you say it's awesome, yeah, it's awesome because it's the power of the body, right? This is so easy. We just need to encourage the body to be successful. So super excited, and the outcomes will speak volumes of what this has done.
Yeah, and let me just add really quick, just one comment, and that is that you mentioned earlier, Bill, that the pandemic has increased weight, right? And in addition, I think it has also increased food insecurity. So moving fast on this was it wasn't an option for us to go slow.
Right.
We had to go fast. We had to serve our members, and so it was very important that we did that quickly.
Andy, it's such a great point. When you have so many times health plans and health systems out there, they recognize the need. But the status quo is strategy. Strategy is great, not disparaging strategy. Vetting, procurement, integration, implementation, rolling it out, hopefully with no hiccups. Here you are 18 months later at best. Have you missed the market? How many members' unmet needs have gone unaddressed during those 18 months? So I think a lesson learned is leverage your existing partnerships, develop those strategic relationships with them so you know what they're up to, what's on the roadmap or pipeline that they may not be providing you or your members today, but that could be expedited or leveraged for additional items in your strategy. And a lesson for us is find more creative people like Bill, who I don't know how he finds the time to sleep to actually execute on this amazing stuff. Two quick questions that I want to address from the audience that came in specific to this food as medicine pilot. From Katie Minetta, how is food delivery tied to program content in that case? Are you giving cooking videos to support it? Is the food delivered limited to whole foods? A little bit more, Bill, that you'd be able to share there?
Absolutely. So I definitely want to be clear that we are not trying to be their food provider indefinitely. The goal here is to provide someone who is stressed out, feeling food insecure, a quick advantage to getting started, feeling better. And then on our website and in our app, we have recipes, cooking videos. We have a drag and drop meal planner so they can actually export all the ingredients to Amazon and Walmart. And actually they can use their EBT cards as well. So we've actually linked it so they can set up and get free delivery for the food. So when we're giving the food trays, it's like, here's the chicken cacciatore. You still have to make yourself a salad. You still have to bring your fruit and some extra vegetables. So we're not really trying to solve, again, for life. We're really just trying to give that short-term advantage and then show them ways in which they can find good, healthy, affordable food, even if the coach is helping them leverage their local food pantry. So the education is already happening in the app. We're doing this through group. We're doing this through videos each day. Of course, tons of cooking videos. And then the community, which is what I'm incredibly proud of, is so supportive. So these folks are coming together. Like you could hear me say it 1,000 times when you go on our internal Facebook group or private Facebook group and you just see somebody's like, just came off my insulin, or finally just went into a restaurant. This was from yesterday. Went into a restaurant and I didn't have to push the table back to get my belly in. These are the folks that are just, it's really emotional if you get into it, because these are people that have been struggling. And here Blue Shield came in and said, I got you. And it's powerful and amazing. And I don't know if I answered the question well, because I get off track, but the food is just to help them initially get started and then learn how they actually can economically fuel their body and feel much better, which is going to change everything in their life. And then take that money they were spending on OTC medications and co-pays and actually put it into something that's happy and healthy.
That was great, Bill. Thank you. I know there's a bunch of other questions coming up, and being mindful of time, I'm gonna jump ahead a little bit in the presentation and just ask, how's it working? So we've been at this a couple of years. The audience now knows the structure, some of the key players, how this generally works. Angie, first with you, how is this working? When you all look at what you set out to do with Wellevolution, a couple of years now under your belt, successful, and what's next? What else do you want to kind of prove out and see on the roadmap to provide even better health for your members?
Yes, it is successful, and we want to do more. So I'll talk about the success first. We have about 42,000 members that are enrolled in Wellevolution. We are seeing about a 5% weight loss for people in the programs. We also are seeing members just drop off medications at kind of exponential levels. I mean, we've heard stories of like, hey, I was on 10 medications and I'm taking nothing now. And not only am I taking nothing, I'm healthy and I'm taking nothing. You know, we have the largest digital therapeutic network. We have our NPS score, which I already talked about. We were the recipient of the Blue Cross Blue Shield Association Brand Innovation Award last year. So lots of really good indicators pointing to our success. And I think one of the reasons that we are successful, and Bill alluded to this when he was talking about, you know, paying for performance. The contracts that we have with all the providers in the network are pay for performance. So all of these providers are saying, we believe in our solution so strongly that we will not get paid unless we hit clinical milestones. So things like hitting 5% weight loss, maintaining weight loss over the period of 4 to 6 months, reducing A1C, reducing medications, reducing blood pressure. The providers are having to hit these milestones in order to get paid. And I see a question in the chat about long-term follow-up. All of the providers are working with the member until they hit the clinical milestones, and then until they are set up to maintain those milestones and move forward. So quickly, because I know we're getting short on time here, what is next? So first of all, grow, and then grow some more in terms of getting people on the platform. We have a whole host of marketing, social media, outbound calls, text campaigns. We're trying to make sure that our members are really well aware that this program is available. And that's easier said than done. And we could do a whole hour talking about marketing. So I won't get into it too much other than to say it is a major focus of ours. So growth volume-wise, and then I would say expansion. And I alluded to this earlier in some of the other conditions that we are looking to expand into: musculoskeletal, more in-depth on gut health, women's health, and then of course the mental and emotional health.
And Bill, I'm going to flash this up while you introduce a couple of guests, and so folks can kind of peruse this data, the quantitative definition of success for better, but maybe actually hear from a couple of users.
Yeah, I think success is going to be what Lori and Carolyn have to say. These are just numbers on a screen, but the numbers are pretty impressive. And one I want to speak to, because someone had a question and I can't help but answer it. She asked about, she had Hashimoto's and multiple disease issues there. And she's saying, some good foods don't work well with her. Well, we see this all the time. That's why we do an elimination reintroduction process, because broccoli for one person is great, not good for other. Going vegetarian or vegan may be great for one person, not for another. So kind of that one size fits all dieting approach doesn't work. Every human being on this phone needs to go through an elimination reintroduction so they can figure out what works best for them. So she's exactly right. A lot of times you get put in a program and it's like, well, they want me to eat on this protocol, but I know that doesn't work for me. And that's true. And then we kind of fight them with science. Well, no, it should work. And you're like, but it's not. So this is that process. So when we did this is a look at what we've just done with the food insecurity pilot here. And people are dropping medications quickly. This is within 60 days. Within 60 days, basically, you're seeing 1.5 to 2 drop in medication. The weight loss over 15 pounds, 8% average weight loss. But the one that's impressive here is improved appetite. We keep thinking it's a mental game. We got to tell people to stop eating. We think they're just sitting around all the time eating. 100% improved appetite. Isn't that counterintuitive to everything we've ever been taught about weight loss and getting healthier? The issue is they're so inflamed and so stressed that most people aren't eating enough. And when they do, they're such in fight or flight that they have cravings for salt, potassium, and sugars. And that's what always holds them back. When you reset the microbiome, when you figure out how to control that inflammation, suddenly you get hungry for more healthy foods because now your microbiome is more diverse. You actually have a much more advanced palate. I can't tell you how many people come to me and say, I don't eat this, I don't eat that, I'll never touch that in my life. And now they're like, why do I love blueberries? Why am I addicted to blueberries? So that of course is going to improve more energy because you have more fuel, the right octane. You're improving sleep. Without sleep, trust me, you are not converting fat to energy. While you're sleeping, you're converting it to CO2. You're literally breathing it out. And then less indigestion, which of course 60% of us have some type of digestive issue. And then we're reducing anxiety. I'm not saying that we don't need to take a mental approach and have people speak with people and use those stress, levers that we have out there. But we're spending so much time, Tony Robbins, everybody, into, getting their mental health issues under control. We don't realize it's actually coming from within. And when you start to look at the gut health and all the studies there. So the slide here is an indication of the success of what's happening and what we're experiencing. But I'd love to bring on 2 amazing people. We'll start with Lori. Hey, Lori, can you unmute?
Hi, Dr. Farah.
Hi.
How are you today?
Good, thanks. We have a member. We're finally doing this in healthcare. We're actually listening to the member story.
Well, thank you so much for having me on today, Dr. Farah. So I came into the program about a year ago through Solero. Thank you so much, Solero, for offering this, and to Blue Cross, because without you guys, I would have never found this. I was on 7 medications between my allergies and asthma and anxiety, because it all seems to go hand in hand. there's illness that seem to like to have friends. So I was on, like I said, 7 different medications. Within my first 28 days, I was getting my gut health rebalanced. I was able to come off of all but 2 of those medications. And I was on some pretty heavy stuff. My pharmacist was disturbed by some of the stuff I was on. But and now I'm actually very proud to say I'm actually weaning off of one of those 2 now currently. But one of the things that really drew me to the program when I had the offerings put in front of me as to what I should, what I had to choose from, was I went through and I started reading the testimonials, and everybody was having so much success with better. And then I had also on my own read about the gut health connection and how our body produces so much serotonin in our digestive system. And so that was really what drew me to the program. And I am forever grateful to Dr. Farrow and to Better. It genuinely changed my life.
And Blue Shield picked up the tab for it, and Solero made the integration happen.
Yes. And again, y'all are doing some good things for people. So
awesome. Thank you, Lori. Appreciate it. And then we got one more, Carolyn.
Hi, Dr. Farrow.
Hi, darling.
Thank you, Solero. And it was because of Solero that I did find better health. I had talked to somebody from my insurance company, and they referred me to Solero, and I got an email of the different options, and Better Health was the one that fit me the best because there was no calorie counting, no carb counting, and the meals I could prep for my family to be able to even share with my husband, who is a type 2 diabetic. I was in the process of being told, the doctor had told me that I needed to go back, that she might have been considered putting me back on diabetic medication. And because of Better Health, I had not been put back on the medication. My mood even improved. And it was before the meal delivery program. I ended up having to cook for my family. And recently I was talking to my son about that, and he said, Mom, you seem to be less stressed when you cook. And it's because of where I'm cutting vegetables, where I'm doing stuff like that. And it just relieves my stress. But it's been so helpful. And I even have been able to reduce some of my medications. So it's been great. And my dad, who had, when I was a child, was trying to push me to cook. And he is now wheelchair bound, can't talk, but he was able to try my cooking. And he actually, one day I was walking by with a thing of shrimp, and he tried to reach in to get one. So that to me says a lot for me, coming from the child who was stubborn with cooking. And I even am eating tomatoes now. I did not like tomatoes before, and I'm now eating tomatoes, which comes to a shock to my brothers and my mother. So it's been a big help.
We are super proud of you. And I know this was tough to come on and share, and probably prior to doing this, your anxiety wouldn't have let you. But here you are, helping inspire other people, and that's beautiful. And thank you for taking the time to do that. We really appreciate it, Carolyn.
Thank you.
Thank you both. That's what it's all about. We really appreciate you sharing your story. I think it brings it all to life, and a great way to wrap this this webinar. Real quickly, expedited version of this. Quick call to action, Angie. Quick call to action, Bill. And then I'm going to turn it over to Thomas just for a couple of closing remarks.
Yeah, I sort of pondered on my call to action, and I think that my call to action really sums up sort of everything we're talking about here, and that is, as health plans, we are working with doctors that are treating conditions generally, and we just need to do anything and everything that we can do to change the paradigm that we are not treating conditions, we are treating humans. We are treating the whole person. And until we introduce a health system that treats the whole person, we have not succeeded. We are taking steps to get there. We're not 100% there yet, but we hope to continue to move in that direction. I would just encourage all of you to do the same.
Yeah, I echo that. I mean, treating the whole person, we have to pick our head up in this industry and say we have to stop siloing every condition and thinking we need to, focus our target on that solution and just focus on the human. The human right now has the blueprint and the DNA inside them to heal itself. You just have to give it the right soil, the right water, the right light. And my call to action, well, I say that what the paradigm shift is, everyone is whole and complete. It's not their fault. They're not lazy and unmotivated. They're stressed out and they need a little bit of help. We're all stressed out. We need a little bit of help. So what I've created this call to action, if you pick up your phone and use that QR code, the first 25 folks that come to us, I'm basically donating the program to them so they can try it out. I'm always about putting my money where my mouth is, so they can try it out for themselves and see if Better Health would be right for their organization. And so my call to action is you just have to act micro locally, like Carolyn just said, and the family starts coming along or your organization starts coming along. So again, Brendan, thanks for putting this together. Angie, as always, it's amazing to keep working with you. Mr. Johnson, thank you for having us, and thanks to everybody for listening.
Thank you. And Thomas, a couple closing remarks.
Sure. Thank you all. Thank all of our experts and Solero for bringing us together this afternoon. I think this webinar has been unique because not only have we seen experts talk about what they are doing out there on a day-to-day basis, but you had a chance to hear two healthcare consumers talk about the value that they've received from the work that's been done here. And I think that's unique. Ultimately we serve those consumers and patients that need that care. And I think today's webinar is a great example of a best outcome that can happen when population health management techniques are used in the right way. So I want to thank everyone for participating, and certainly thanks Solero for bringing everyone together today.
Thank you for the opportunity. Thank you for the amazing questions. I know my time management failed me again. We didn't get through all of the questions. I wish we had more time, but do want to be respectful of folks' calendars. We do have all these questions logged, and we'll do our very best to respond to all of them in short order. You can reach out to any of us individually or collectively. Find me on LinkedIn and the others. We'll be happy to continue the conversation and see how a partnership like this may be able to support you in your journey to better health. So thank you, everybody. Enjoy the rest of your weeks. We'll be sending this webinar out by Wednesday or early tomorrow. Please do feel free to share. Thank you.
Thank you.
Thanks.